From Just Facts headquarters, I'm Jim Agresti, and welcome to Just Facts News, where we bring you thoroughly vetted facts that other newscasts have ignored or distorted. In a recent episode of CNN's Inside Politics, host Manu Raju reported on a matter that is at the heart of the government shutdown, the costs of Obamacare. After explaining that Democrats are demanding a permanent extension of enhanced Obamacare subsidies before they agree to reopen the government, Raju introduced journalist Tom Foreman, who said the following would happen if these temporary subsidies expire.
4 million people become uninsured almost immediately based on some estimates out there. Dramatic rate hikes would follow as well. How high would those rate hikes be? Well, if you were making $18,000 a year, not much, your current premium for this is $0. That's great, but then $378 is your new premium. $378 is the change. If you're making $35,000 a year, your current premium, $1,033. Your new premium, if it expires, look at that, more than double, so up 15, almost 1,600. And if you're 55,000, 4,000 jumps up to 478, another giant jump there.
Here's what CNN failed to tell you. Those are not monthly premiums, the common way that health insurance is quoted, billed, and paid. Instead, they are annual premiums, which means that a person making $18,000 a year would pay only $32 a month for health insurance. A person making $35,000 a year would pay only $218 a month. And a person making $55,000, $457 a month. In fact, Obamacare recipients currently pay an average of just $74 a month for health insurance. And once the enhanced subsidy expires, they would pay an average of only $159 per month. How can this figure be so low? Because the original Obamacare subsidies will remain, and taxpayers will still pay the bulk of the tab for these policies. Foreman then continued.
Look at this on what they call higher earners. Imagine an older couple out there who's making $85,000 a year. That's not billionaires or anything like that, but that's a higher earner in this case. Here's their current premium. $7,225 per year. That's 8.5% of their income. That's sort of the top end under the current rules. Under the change, if it expires, that will jump to $25,000 per year. That's almost a 30% increase. That's almost 30% of their income, not an income, 30% of their income for the year.
Here's more of what CNN failed to tell you. This is an extreme scenario of people who fall just outside of the maximum income threshold for receiving the original Obamacare subsidies, which is 400% of the poverty line. So even if the enhanced Obamacare subsidies expire, a family of two with up to $84,600 in income can still receive this welfare, as well as a family of four with an income up to $150,600. More importantly, these figures reveal that this Obamacare plan for only two people costs $2,109 per month under the Affordable Care Act. And taxpayers will have to shoulder more than 2/3 of this burden if the enhanced subsidies are extended. On top of that, most working taxpayers who foot the bill for Obamacare and have health insurance via their employers must also pay the full costs of their own insurance because these costs ultimately are taken out of their other compensation. This is a major cause of wage stagnation. Foreman also reported.
And if you look at who's going to be hit if this expires, you can understand why some Republicans are also saying, yeah, maybe we need to get around to this now, because look, these are the hardest hit states if the credits expire. California, Texas, Florida, Georgia, North Carolina. That's where you have the highest number of enhanced subsidy recipients. And this one, all voted red in the last presidential election. The truth is, if these expire, this is going to hit a lot of people in this country, millions of people. and a lot of them in red states that backed Donald Trump.
Here's yet more of what CNN failed to tell you. Even in the states that are hardest hit, slightly more than 10% of people receive enhanced subsidies, not the bulk of the state. And most of these people will still be eligible for the original Obamacare subsidies, regardless if the enhanced ones expire. Incidentally, Foreman leads CNN's fact-checking initiative, and the CNN report on Obamacare is emblematic of what happens when journalists don't report all of the relevant facts, but only those that serve a certain narrative. In other words, half the truth can amount to a total lie. Thank you for joining us. Tune in next time for more thoroughly vetted facts that other newscasts ignore or distort.